If you're turning 65 soon, already enrolled in Medicare, or just trying to make sense of the nonstop mailers and confusing TV ads, then stay with me for the next few minutes. What I'm about to tell you could be the difference between predictable healthcare costs for the rest of your retirement and thousands of dollars slipping out of your pocket every single year without you even realizing it. Most people don't learn this until it's too late, but today I'm uncovering exactly what Medigap really is, who actually benefits from it, and whether it's the right choice for you. And trust me, by the end of this video, you will know more about Medigap than 90% of Medicare users in the country. Now, before we dive in, let me give you the reason you absolutely need to listen carefully. Every year, countless seniors pick the wrong coverage simply because the differences between Medicare Advantage and Medigap were not explained clearly. They thought they were saving money by choosing a plan with $0 premiums, but later discovered that one hospital stay, one extended rehab visit, or one major illness suddenly exposes them to bills they never expected. On the other hand, some retirees buy Medigap because a friend recommended it, even though their health situation and income level might not require such extensive coverage. So the real question is not whether Medigap is good or bad. The question is whether Medigap is good for you. Let's start with the truth most agents don't like talking about. Medicare, Part A and Part B cover only about 80% of your medically necessary services on average. That remaining 20% might not sound like a lot now, but for a major surgery, a long hospital stay, or ongoing treatment for something like cancer or heart disease, that 20% can easily climb to thousands or even tens of thousands of dollars. Medicare has no cap, no protection, and no limit on how high your out-of-pocket costs can go. This is the number one reason Medigap exists in the first place. Medigap was designed to plug the holes in Medicare, giving you financial protection, so your retirement savings stay where they belong, with you. But here's where things get interesting. Not all seniors need Medigap, and not everyone benefits from it the same way. The first thing you must understand is how Medigap works behind the scenes. When you go to the doctor under Original Medicare, Medicare pays first. Then your Medigap plan pays its part automatically. This means no networks, no referrals, and no worrying about whether a specialist accepts your plan. If they accept Medicare, they accept your Medigap plan. That's one of the biggest advantages, and for many seniors, especially those who like to travel or spend winters in a different state, this can be a priceless benefit. People who value freedom of choice, predictable medical costs, and nationwide coverage tend to lean toward Medigap. But there's another group that shouldn't ignore this option: people with chronic health conditions. If you're someone dealing with diabetes, heart disease, COPD, or cancer history, you already know how quickly medical bills can pile up. A Medigap plan can drastically reduce those lifelong expenses. And the best part? Once you're enrolled during your guaranteed issue period, typically your Medicare Part B start month plus 6 months, your approval is guaranteed. No health questions, no medical underwriting, no risk of being denied. For many seniors, this window is the most important opportunity they will ever have in Medicare. But you might be wondering, if Medigap is so good, why doesn't everyone get it? The answer comes down to premiums. Medigap plans cost more upfront than Medicare Advantage. And for some seniors, especially those on fixed incomes who rarely visit the doctor, that monthly cost might feel unnecessary. That's why I always tell my viewers this simple rule. Medigap isn't about paying less today, it's about protecting yourself tomorrow. It's a safety net that keeps your healthcare predictable and prevents financial surprises. Now let's talk about cost realistically, because this is where many people get confused. Medigap premiums depend on your age, your state, your tobacco use, and the company you choose. Some states have significantly higher rates due to local regulations. Other states have community-rated pricing, which can be more stable long-term. And here's a fact most people don't know. Medigap plans are federally standardized. That means Plan G from one company gives the same medical benefits as Plan G from any other company. So why do people pay different prices? You're not paying for more coverage, you're paying for the company's pricing structure, reputation, and rate history. This is why shopping smart matters. Many seniors end up paying more simply because they didn't compare. But let's come back to the real question. Is Medigap worth it for you? To answer that, you need to think about your lifestyle your health, and your financial comfort zone. If you want low, predictable out-of-pocket costs and the flexibility to see any doctor who accepts Medicare nationwide, Medigap is usually the better fit. If you travel often, especially across states, Medigap fits you perfectly. If you want to avoid surprise bills after a surgery or extended hospital stay, Medigap can give you peace of mind. And if your biggest concern is protecting your retirement savings long-term, Medigap delivers one of the strongest financial protections available to Medicare beneficiaries. But Medigap isn't ideal for everyone. Some seniors prefer the simplicity of zero-premium Medicare Advantage plans. Others like the built-in extras such as dental or vision. And some simply don't have room in their budget to pay for Medigap premiums, and that's okay. What matters is that you make the decision that fits your needs, not what a commercial, a mailer, or a salesman tries to convince you of. Something else you should keep in mind is the long-term affordability. As you age, Medigap premiums can increase. The amount and frequency of increases depend on your state and the pricing model your plan uses. Some companies raise rates more aggressively than others. That's why looking at rate history is almost as important as looking at the monthly premium. A cheaper plan today that increases rapidly could cost you far more later. The right choice is the one that remains affordable long-term. Another important factor people forget to consider is underwriting. If you choose Medicare Advantage now and try to switch to Medigap later, you might be denied due to health issues. People often don't realize this until they try to switch and find out they no longer qualify. So the question isn't just, do I need Medigap today? It's also, will I be healthy enough to qualify later if I wait? Many people regret not choosing Medigap when they had the chance. Let me paint you a scenario I've seen many times. A healthy 65-year-old decides to start with Medicare Advantage. They feel great, rarely visit the doctor, and love the idea of a low-premium plan. But 3 years later, they develop a heart condition. Suddenly, doctor visits, specialists, and hospital stays become part of life. Now, they want the freedom and predictability of Medigap. But because of their new health issues, they get denied during underwriting. They end up staying on a plan that costs them more in the long run, simply because they didn't understand how important that first decision was. Now, let's flip the scenario. A 65-year-old chooses Medigap Plan G when they first enroll. They pay their premium each month, but in return, they know exactly what to expect. They can see any doctor. They can travel anywhere. They avoid unexpected bills. And as they age, their coverage remains solid, predictable, and stable. Their retirement stays protected. That's the real power of Medigap. But this doesn't mean Medigap is automatically the right answer. You have to weigh your options carefully. Consider your current health. Think about your long-term needs. Ask yourself how much risk you are comfortable taking. And remember, the cheapest plan is not always the best plan. The most expensive plan isn't always the right one either. The correct plan is the one that matches your health needs, financial situation, and lifestyle. By the way, since you're watching this video, I want to give you something important. Most people make their Medicare decisions without fully understanding their options. That's why so many seniors end up confused, overwhelmed, or stuck with a plan that doesn't work for them. So if you want future videos that break down Medicare in simple, easy language, videos that help you save money, avoid penalties, and make smart decisions, then take a second right now and subscribe to Medicare Mentor. It helps you stay informed, and it helps me keep bringing you content that truly makes a difference in your life. Back to Medigap. Let's talk about Plan G for a moment because it's the most popular Medigap plan for new Medicare beneficiaries. Plan G covers everything except the Part B deductible. After that deductible, your medical costs are essentially zero for Medicare-approved services. That's why so many seniors choose Plan G. It offers simplicity and predictability. There's also Plan N, which is slightly cheaper but comes with small copays for certain services. Plan N can be a great choice too, especially if you're healthy and want to save on premiums. Both plans offer strong protection, but the best choice depends on how often you visit doctors, whether you prefer predictable costs, and how much you're willing to pay each month. You should also know that Medigap does not include drug coverage, dental coverage, or vision benefits. For prescriptions, you'll need a separate Part D plan. For dental and vision, you can purchase standalone policies if needed. Some beneficiaries misunderstand this and assume Medigap is all-in-one coverage. It's not. Medigap pairs with Original Medicare to cover medical costs, not extras. But the trade-off is the freedom to choose your providers and the protection from high medical bills. Let's take a moment to talk about something you rarely hear in Medicare discussions: peace of mind. For many seniors, knowing that a hospital stay won't destroy their savings, knowing that a specialist visit won't lead to unpredictable bills, and knowing that they can travel freely without worrying about networks is worth every penny of a monthly premium. If you value security over uncertainty, Medigap might be exactly what you need. But I also want to be honest with you. Medigap isn't magic. It doesn't fix everything. It won't cover dental implants. It won't pay for hearing aids. It won't include gym memberships or meal delivery programs. So if you're someone who prefers additional perks, a Medicare Advantage plan may appeal more to you. But those perks must be weighed against medical flexibility and long-term financial protection. Many seniors also ask whether Medigap is likely to become more expensive over time. The truth is that all health-related insurance tends to increase. But Medigap increases are usually more predictable compared to out-of-pocket expenses under Medicare Advantage. With Advantage plans, you may pay less today, but your costs can be unpredictable when you need care most. With Medigap, you pay more today but protect yourself from large expenses later. It's a trade-off, one that depends on your personal priorities. By now, you've probably started to see whether Medigap matches your lifestyle. Maybe you're someone who prioritizes access to specialists, wants to avoid networks, and doesn't want financial surprises. Or maybe you're someone who prefers low monthly costs and is comfortable with managed care. Either way, the key is making an informed decision, and that is exactly why this channel exists. If you're still unsure whether Medigap is right for you, then make sure you stay connected with Medicare Mentor by subscribing. My goal is to help you understand the fine print before it becomes a problem. When it comes to Medicare, education is your strongest protection. Now, as we approach the end of this video, I want you to ask yourself one important question. If my health changes tomorrow, would I feel confident with the coverage I have today? If your answer is yes, then you're on the right path. If your answer is no, or you're still unsure, then researching Medigap more deeply is one of the smartest decisions you can make. Remember, Medicare isn't one size fits all, and what works for your neighbor or your relative might not work for you. Medigap is a long-term decision. It's about protecting your health, your finances, and your peace of mind. It's about having the freedom to choose any doctor and not worrying about whether your plan will cover you. It's about knowing your costs up front instead of being surprised later. And most importantly, it's about giving yourself the comfort and confidence you deserve during your retirement years. You've spent your whole life working, saving, and planning. Your healthcare coverage in retirement shouldn't be a gamble. Whether Medigap is ultimately worth it for you depends on what you value most: predictability, flexibility, or low premiums. My goal is to help you understand your choices clearly so you can choose with confidence. If you found this video helpful, make sure to subscribe to Medicare Mentor so you never miss valuable Medicare guidance. Your health, your money, and your future deserve clarity, not confusion. And I'm here to make sure you get it. Thank you for watching, and I'll see you in the next video.